Okay, I just made like a 15-minute video with this stupid effing microphone. And it obviously didn't work because when I played it back, there's no sound. So screw the microphones. I'm not going to use it. I wanted to make this video so that I could let everybody know what's going on. 2 years ago, I made a video sitting right here telling everybody I had end-stage renal failure and that I was probably going to die because I wasn't going to do dialysis or anything. And a year and 4 months after that, my body swelled up and had a little heart attack and spent 10 days in ICU back in May of last year. And that's where I didn't have a choice. I was imprisoned in a hospital, and so they pulled in the dialysis machines, and that's when I started it. So it wasn't as traumatic, I would say, being in ICU and being covered in a whole bunch of electrodes, and all that. So it was just all traumatic, but it was like part of the being in the hospital. But I couldn't get released from the hospital until there was room in a dialysis clinic, which isn't that easy. I mean, there's a lot of people waiting to have a chair. So I had this one doctor who he says he knows everybody, and he made a phone call, and I got into Puget Sound Kidney Center in Everett right away. And so that was the beginning of hell. Place was packed. Everybody in there is so sad that's sitting in a chair, and it was super depressing. And I managed to get into the clinic in Monroe, which was a little bit better. I go the back roads. I don't even have to go into town, and it was 20 minutes to get there, and it wasn't crowded at all. They had extra chairs, and they have tons of plants and skylights. So it was a better environment, but you still get two 15-gauge needles stuck in you 3 times a week for 3.5 hours. So it was hell. I cannot begin to tell you how awful it was. Not to mention the fact that, the side effects of kidney failure, like my kidneys were at 4%. So I'm a stubborn girl. I will continue to do what I do no matter how I feel. So whether it's running or working in the yard or, taking care of the pool, clean the house, making suits, whatever, I would always just do it no matter how bad I felt. And I never thought that I would be, I never thought of my kidneys. I was always thinking of my liver and my heart and my intestines, and I never thought about my kidneys. And having an extremely high protein diet with high oxalate vegetables, that's really what did it for 30 years. I was eating keto before it was called keto. And, let me be a perfect example for people that do eat that way. And I did it for a few decades, and that's really what caused it, because it wasn't, drugs or drinking or anything like that, because I don't do that. So, and I told them about all the supplements I take. I personally think that it was, before I'd run in the morning, I'd have coffee, aspirin, ephedra. That was just my routine. And I do believe that had something to do with it too. So anyway, I had to go through all the tests. Let me tell you what dialysis does. Dialysis pulls the water from your blood. So when you drink water, it goes into your blood system, and then it goes through the kidneys and you pee it out. And so when your kidneys are dead, it can't do that. And so the dialysis machine's main job is to pull that water out. It only cleans 15% of your blood, so you're toxic all the time. They will add in like iron and D3 and things like that, but it can't clean the blood full, which is why you feel like shit every single time you get done with dialysis. Your day is absolutely ruined no matter what time it is that you go, because you're wiped out when you get home. And so 3 days of my life was not really in existence. I had 4 days a week to do whatever it is I had to do, including making suits or whatever. So then I had to go and make all these appointments for all the tests that Virginia Mason wanted me to do, and there were a lot. And I made the phone calls. Took forever to get appointments, but I was persistent. And I had my last appointment in March for the testing. And then once that testing was done and all my tests passed, which passed with flying colors, I got on the list officially. But then what they do is they send you, the blood bank sends you a tube, and you go to dialysis and they fill the tube up and you put it in a cardboard tube with the address for them and you send it off once a month because they're always testing. So you have to keep it fresh. So once I was on the list, I only sent in 4 tubes. And then 3 weeks ago, I got home from dialysis, went to bed, woke up at 1 o'clock to a phone call saying, "This is Virginia Mason, can you make it in at 10:30? We have a kidney." So that was absolutely shocking because it happened so fast. And by 4 o'clock that day, I had a kidney in me. And the irony too is my friend Katie, I've known her for 5 years, and she started out as a client and we became good friends. She had offered last year to be my caregiver for a month. Well, she recently got a divorce, and so she moved in with me a little over a month ago. So she was here, and it was so nice. Don't touch that. So then she came in and, woke up and we went. So didn't have to call her at her old house, and Lynn wouldn't wait for her. She was here. So everything worked out really well, except the fact that I have 2 Cane Corso puppies, and place was pretty messed up when I got home after 5-6 days. That's really bad. And also, coming home to heal and having 2 insane Corso puppies. Who wants to sit up here right now? One of them. That was rough. That was pretty rough. It still is. I'll never have 2 puppies ever again. So I'm not out of the woods yet. This is Franny Pants. I'm not out of the woods yet. Won't be for, probably 6 months because you just don't know. But bittersweet, it was a teenage kidney. So sadly, somebody died for 2 of us to have a kidney. And as of now, my hemoglobin's still a little bit low, but through high iron foods, I'm getting it up there. And then he's also concerned about the blood flow. So they told me that in the beginning because it's a really healthy young kidney, except that it by the time that they removed it and all that, it had had no blood flow for a little bit. So they had to get that going. He told me that it might be a little bit taking longer to kickstart. But as soon as I had that surgery, I didn't have itchy skin anymore. And, as crazy as it sounds, to be able to pee like a normal human being is amazing. It's just so nice to be able to pee and be normal again. The only thing that was hurting was where the stitches were. You don't feel anything inside you. And I'm dying to be able to work out again, so that'll be a couple more months. I'm still, immediately I was walking the next day after surgery, and now that I'm home, we go up back in the woods, and, we go about 2 to 3 miles every morning, but I walk, I don't run. And trying to get used to the fact that I'm not gonna die, so after Dave died, I thought, well, I'll be there pretty soon anyway. Now I'm accepting the fact that I'm going to be a widow for a very long time, and I do miss Dave dearly. And he built this place for me, and so he's everywhere. But it was just crazy. I got end-stage renal failure. I lost my husband. I had to kill my horse. And then my Corso Lysa had a stroke. So I'm a country western song because I still love my truck. And it's just classic. But I've got Silky still, and I've got the 2 puppies, and won't be doing horses anymore. I'm just, Mom and I are both a little too old, and it's just very pricey, and having to rely on farriers and veterinarians is just almost impossible nowadays. Let me lower this a little bit because, there we go. So I'm trying to think of all the details of of what happened with me because it was 2 years ago that I posted a video right here, sitting on this chair, on this couch, saying that I had end-stage renal failure. And, you know, it kind of shocked everybody. And it was like, oh, it's so tragic. And, you know, I can't look at things like that. I've accepted death. You know, it's like something that's unavoidable, but I wasn't afraid of it. I didn't like, you know, I didn't go through the thing where I don't want to die and all that. I did it like very temporary, but it didn't last long. It's like, it is what it is. But I did think I was going to die my way. So I thought I'd be on my horse in the woods with the dogs and I would just drop dead. And my nephrologist kept telling me, that's not how it's going to happen. And I would say to him, you just don't worry about it. That's how I'm going to die. And then back in May of last year, my body swelled up so bad that I couldn't even put shoes on. And so it wouldn't have been the way I thought it was. You know, the kidney failure, I went 1 year and 4 months without dialysis, and then my body just swelled up so bad. I gave myself a heart attack. You know, seriously, I gave myself a heart attack because my body was so full of fluid that my lungs squeezed my heart. And so that's why I ended up in ICU and on dialysis. I'm a stubborn girl, and everybody that knows me knows that. It's like I will continue to just keep moving no matter what. And if it has to be done, it has to be done. So I don't have time to lay around and be a hypochondriac. So that's pretty much it in a nutshell. I am going to live. I will have to take pills the rest of my life. I'm a little bitchy because I'm on this thing called Tacro something and prednisone. So I'm a swollen puffball and I'm bitchy. I have very short temper, and I can't take or do anything except meditate, you know, because can't take any other substances to calm me down. I just have to take a deep breath, listen to my spa music almost 24/7 because it's relaxing and calming. You know, I can't listen to very much rock and roll right now because I just tend to get a little grumpy and angsty. And fortunately, everybody around me knows that I'm on the barbed wire drug. And I have about 30 pills I take a day. So those will eventually drop down. I think I have like 13 different pills. But by December, I should be only on the 3 anti-rejection drugs. I'll be off of all the other stuff, including the prednisone. So one of them I think that I'm going to be on forever. They said it could cause some hair loss, and I'm like, I do not want to go bald again, because the 3 years ago when I was bald was probably worse than the kidney failure. There's nothing worse, and I don't give a shit. I don't care if it's like an in-style thing. I don't do bald very well, and I will make damn sure that that doesn't happen again, because that was probably the worst thing in my life, was being bald, and humiliating. So hopefully that won't happen. Anyway, I'm here. I've made a complete 180 in my life. I closed my website down for the bodybuilding competition suits. I'm no longer going to do that. It's time to move on. You know, almost 40 years of doing that, I'm kind of sick of it. And the industry's changed so much that it's just not fun anymore. So I'm okay, and you know, I can get by financially with the investments that my husband had set up for me, and I just, you know, everything he did was for me, and I don't know, that's all I have to say about that. I will be a widow forever because I love him so much. And so what I'm going to do is I'm going to start draping again. You know, I have my mannequins, and I'm going to start draping and doing one-of-a-kind clothing and just hang it up in my shop. So if somebody wants to come over and thumb through them, it's fine. But I'm not desperate, and I'm not going to be cheap. That's for damn sure. So that's what I'm going to do, and continue to take care of my property and the house. And I got trees to have cut down and gutters to fix and all that. anyway, I could just rattle on and it gets boring, and who wants to watch me anyway? So that's it. I just want to let everybody know I'm okay. And now that I have a kidney, I can move on, and hopefully I'll look back on this and laugh someday, maybe. I don't know. It was a sheer hell, and I've gone over that bridge. And I also want to thank everybody. I have so many friends that had prayer groups that just prayed all the time for me, and also did chanting for me, and don't think that didn't go unnoticed. So I'm gonna get off now and go figure out what I'm gonna do besides mow the lawn. Thanks for listening to me, and I hope everybody stays healthy and get your blood work done. No matter what, whether you work out or not, get your blood work done, because that is how that's how I found out that I had 4% kidney function. So make sure you do that. Don't be Mary. You do not want to be me. Have a good day.